Hello, my name's Joe Johnson. I want to talk to you about peri-implantitis and how to treat peri-implantitis, and if you've got it, how to get rid of it very quickly. But if you think, well, what does he know about it? Well, just a few weeks ago I had a big implant operation, and let me show you. You see, I had my two front teeth on a bridge, and the bridge covered the front there. But I damaged the bridge. I went along to the dentist. He said, you're going to need implants. I went along to see a specialist, and the specialist, one of the best in Britain, said, you're going to need a big bone graft all the way across the top of your jaw. You're going to need an implant in there, and you're going to need an implant in there. So we agreed to it. And that's what happened 3 weeks ago. One thing the fella never mentioned to me was the word implantitis. Now this story's got a happy ending, so please listen. I went along, before I went along he said, here's a prescription. The appointment was on a Friday. He said, come on Friday, but make sure you have 3 grams of antibiotics before you turn up. So I did. Even though I'm into natural remedies, that's why I make my living, natural remedies. But he said, look, you don't want to get a deep infection. I'm going to put a piece of bone graft into your jaw to make it strong enough for these implants. I said, okay. I went along, he gave me the local anaesthetic. I didn't need the sedation, I said I didn't want it. He then cut open my jawline. He's put a bone graft in. He's then put a dental implant in there and a dental implant in up there. And like that. 3-hour operation, 20 odd stitches in my mouth, put my dentures back in and sent me home with a prescription of drugs. A week's supply of 500 milligram of amoxicillin I had to take 3 times a day. And he also gave me 400 milligram of metronidazole, another type of antibiotic, that I also had to take 3 times a day for a week. He said, any problems, use salty water, or if you want to, use a mouthwash. Okay. I didn't anticipate any problems because he didn't. The next day, this is what I looked like. So as you can see, my face had begun to swell. 2 days later, my whole face was like a balloon. I couldn't have the dentures in because the gums were so swollen, inflamed, that I couldn't get the dentures in. I couldn't eat properly. I couldn't allow anything to touch the gums. I tried salty water, nothing happened. I spoke to a friend, I spoke to my dentist and I spoke to the other dentist, and they said try these mouthwashes. I tried that, it didn't work. They said try some of this fancy dental gel, that didn't work. I was in agony pain wise, they said take that. Ibuprofen, it didn't work. I wasn't sleeping because of the pain, they said take that. Tramadol, that should do you good. Made me high as a kite, didn't work. I couldn't eat, I couldn't drink, I couldn't go to work, I didn't know where to put myself. This is implantitis, something I had never heard of. My local dentist, I was going bananas. I went to see him. He said, I'll make you one of the... look at this. It's like a gum shield, but with teeth on the front. Now he made this just to reduce, you see, because if you've got a dental denture, if that dental palate is touching where you had a gum operation, or the gum's swollen, it's in agony, I couldn't wear it. So he gave me this thing for a few £100. Looks like teeth. No pressure on the gums, which is good. I can't eat with it. It's not satisfactory, it's making me gag. But it means I could walk outside of the house and look like I've got teeth in. After 7 days of suffering this peri-implantitis, something that they'd never mentioned to me beforehand, Here's all the paperwork they give me beforehand, the plan estimate, the disclaimers, all the types about the anaesthetic, the things that can go wrong, aftercare and maintenance. Even on the aftercare and maintenance, it doesn't mention peri-implantitis, nowhere. And I had it, and I didn't know what to put myself. I just didn't know where to put myself. Anyway, after a week, a bloody week of agony, I'd had the antibiotics. The guy said I wasn't infected, even though I had blood and pus coming out. He said, just hang in there, everything's going fine. So I thought, what am I going to do? What can I do myself? Now, as I mentioned, I make a living from natural remedies. 22 years ago, I came up with the remedy and I called it Gum Doctor. And it was designed for people. I mean, dental implants didn't exist 22 years ago, not as far as I know. What I wanted was a remedy for people with bleeding gums, receding gums, swollen gums, spongy gums. And I knew how herbs worked. I knew what natural remedies, I knew that's my business. So I came up with this stuff, Gum Doctor. It's just 4 plant extracts. And I'll show you what I did. I thought I've nothing to lose at this stage. Bearing in mind I didn't have the dentures in then. See that brown liquid? That is it. And I just touched it onto the gums. And I cut all over the stitches. Now I couldn't touch myself there 2 weeks ago. Just a couple of drops, put the cap back on, and I'm sat there and I'm thinking, after a couple of minutes I thought, hang on a minute. Am I imagining this? Bearing in mind it's my remedy. Am I imagining this? I put it on again. The pain, the soreness, the inflammation started to go down instantly. Oh Christ. So this was about 8 o'clock at night. I put some more on, went to bed, put some more on. I woke up in the morning, well I got a good night's sleep, the pain didn't wake me up. I woke up in the morning, I could get the dentures in. I could get the dentures in. No pain, the inflammation had gone right down. This periodontitis, all these fancy words that they give this stuff. The gums, this stuff, this Gum Doctor had just helped my body to heal. Reduce the inflammation, reduce the infection, and my body was on with it. And I just rubbed a few more drops on several times a day. I could eat what I want, drink what I want. Now obviously I've not had the dental bridge put back in yet, which is like living proof of what I'm showing you. If you could see on the camera there, can you hear? This titanium rod sticking out there, they call abutment. The gums are healed. Look, I couldn't touch these 2 weeks ago. I can eat crisps, chips, whatever, nuts. The gums have gone hard, they're healing. Everything's alright with the stitches, they've all gone. My gums feel fantastic. That's all. I mean, I'm not saying, obviously the doctor knew what he was doing, the surgeon knew what he was doing. I'm not saying I wouldn't take the antibiotics, I'm just saying, if you've got implantitis, get this stuff instantly. Instantly. And get it on as soon as you possibly can. By all means discuss it with your doctor, your oral surgeon, whatever you want to call them. It will work for you. If it doesn't work, you can have your money back, but it will work. But more importantly, I mean, if you've got it now, this will work for you. But if you'd have seen this video before you had implants, I'd have said get it. Because if I had my time again, yes, I would still take the antibiotics, but I'd put this stuff on as well. Because I'm damn sure the inflammation would have gone in a few days. So that's perio, whatever they call it, all these fancy words for it. But basically, your body needs a helping hand. The antibiotics do kill off a lot of bacteria. But it didn't do the job for me. It was only until I used the Gum Doctor that everything was fine. And I'm really happy for me for discovering this stuff. I'll be happy when I get this denture out and get me implanted bridge put back in. I'll be happy when that's done. But I've rediscovered just how good this remedy, I mean, apart from a few bleeding gums and receding gums, spongy gums that I've had over the years when I just put a few drops on, I've not used this stuff for 15 years. And it's amazing. It's helped me and it'll help you, and I'm looking forward to helping you with this stuff. Alright. Now somewhere below this video there'll be a buy now button. Or there'll be a button, click the link, click on it, get to the gum doctor and let's get it sent out to you straight away. Alright. Thanks for watching this video. Bye for now.